Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. So welcome to the Healers Café, and today I'm with Dr. John Poothullil. I hope I said that right. And you're a retired physician, a pediatric physician, and allergy and immunology specialist. And your focus has been on, well, I guess the later focus is on diabetes and a lot of the misconceptions that we have about obesity, about diabetes itself, about what to do if you're diabetic, and that touches on eating habits. You have lots of books available and videos that help educate people on what they can do. So welcome to this discussion. And why don't we start where we were where we were just before I turned the recorder on. Tell us a little bit about, in India, the obesity rate and that have diabetes compared to the United States obesity rate, and why is that significant?
Yeah. Before I go there, may I make a distinction and a generalization of what is diabetes and what is type 1 and what is type 2?
Absolutely.
Diabetes is diagnosed with just one test, elevation of blood glucose. There's no other confirmatory test. So anytime blood glucose is elevated, either pre-diabetic or diabetic.
Yeah.
There is this divided into two groups, type 1 and type 2. The importance of blood sugar elevation is based on the availability of insulin. After each meal containing carbohydrates, your blood glucose level goes up. That stimulates the pancreas to release insulin, and insulin is needed for the cell to use glucose. Let me give you this analogy. If somebody rings the doorbell, if your doorbell rings and you know there is somebody outside, and you have the option of let that person in or not by opening, sometimes with the new gadgets, you can even see who it is. When every cell in the body, 30 trillion cells, can use glucose to produce energy, but glucose has no doorbell. It can ring to let the cell know it is outside. That is the job of insulin. So if insulin is not there, glucose accumulates outside the cell, but the cells starve inside. Mm-hmm. Children are used to have the type 1 diabetes where their pancreas did not produce enough insulin. These children used to die by age 10 until Banting and Best in Canada discovered and administered insulin. With that, their lifespan became normal, quality of life improved. The person who treated the maximum number of type 1 children was Elliot Jocelyn of Boston. You have heard of Jocelyn Clinic, that is named after him. He treated about 400 plus type 1 patients, and he was so amazed that it's a lifesaver for them, insulin. When he trained some nurses to go out into the community and give these children insulin. So they asked, how do we keep up? How do we determine the dosage? Because each child is different in its activity level, in its eating habits. So Dr. Jocelyn went back to he kept meticulous records of his patients and found out that if you give enough insulin to keep the blood sugar within normal range, that is the dosage that the child needs. Now, when his older aunt or relative came with high blood sugar, Dr. Jocelyn thought it is the same disease, but happening at a later age. He called it adult onset diabetes. Remember, at that time, there was no blood test available to measure insulin in the blood. Later, when that test became available, endocrinologists had a shock because adults with high blood sugar had normal levels of insulin appropriate for their age. That confused them. So then they changed the name to non-insulin dependent diabetes. That created a different set of problems because if you want to get insurance reimbursement, you need to have a CPT code. Get the code, you need to establish what is the cause, what is the effect, what is the treatment, and what is the logic, and how do you establish it. But if it's a non-insulin dependent, it is a separate disease from the type 1. So they manipulated the naming into type 1 and type 2. So they could piggyback the CPT code on type 1.
Okay.
This is how it started.
Wow. Yeah. That's, I mean, it's interesting. I've actually never heard that story. I didn't know how that happened.
Yeah.
Well,
Then they found out most of the adult onset diabetes are people who are obese or overweight.
Right.
Now, the question is, how do they determine who is obese and who is not obese? That's another fascinating story because that was not done based on actual measurements of patients or people. They asked the Metropolitan Life Insurance Company the age appropriate weight.
Okay.
And the Metropolitan Insurance Company told them average what each person's weight should be at a particular height and gender. And they accepted it as truth. Now, this is all based on white ethnic population. And that's the same weight table that is used all around the world. In our medical textbooks, that is what we learned. So almost every Indian child is underweight or not up to.
Right, of course, yeah. Wow.
Okay. Now, so based on that, they found out 85% of adults who develop high blood sugar are obese. But in India, 60% of the adults who develop type 2 diabetes are not obese. So how do you determine that obesity? So what I have come up with in my book, Diabetes, the Real Cause and the Right Cure. This is the book. Okay. What I'm suggesting is we all inherit a certain amount of fat storage capacity. After a meal, the liver keeps 120 grams of glucose if you have a high carbohydrate meal. The rest will be converted into long-term storage to fatty acid and to fat, send it to fat cells. If fat cells are full, the fatty acids stay in the blood. Our muscle is the biggest producer of energy, but muscle ordinarily produces 70 to 80% of energy, not from glucose, but from fatty acid. Otherwise, if you don't eat whole day, you cannot survive.
Right.
Heart muscle uses almost exclusively fatty acid because heart cannot depend on glucose to be available all the time. So body is very used to using fatty acid. In fact, if the fatty acid level is high, it automatically switches to fatty acid burning. So now let's go back. If you inherit a 10-pound fat storage capacity, when that capacity is filled up, the fatty acids stay in the blood and the muscles convert to fatty acid burning, leaving glucose in the blood. If, on the other hand, if you have 50-pound fat storage capacity, you will gain weight, but your body is still using glucose because the fat is stored inside the fat cell.
Right. Mm-hmm.
So obesity is a visual thing. It's a cosmetic thing. That should not be a medical consideration.
Right.
For medical consideration, you need to know the fat storage capacity that you inherited. In India, for thousands of years, people are lean. Whereas in Western countries, they have more fat because of the climate as an insulator. Most people who are in the colder weather, temperature, climate areas, they have more fat. That's a natural protective mechanism. So if an Indian and an American gain the same amount of weight, the Indian may be diabetic, but the American won't be. And this is exactly what happens in young women who develop gestational diabetes.
Right.
Without any family history, with no previous history. When a young woman gets pregnant, everybody is encouraging her, eat this. This is good for the child's complexion. This is good for the child's intelligence. This is good for his height, his muscle. She eats and eats, fills up the fat storage capacity. By the end of second trimester, her fat stores are full. The fatty acids stay in the blood. Her muscles switch to fatty acid burning, leaving glucose, and she's diagnosed with gestational diabetes. After delivery, when she loses weight, the fat stores are empty. Now the fat can be stored, her diabetes disappears. Now tell me, how can insulin resistance come and go like that?
Yeah. Yeah. No, it doesn't make sense. Yeah. So how do you explain that it's still what is being said?
Oh, that is an interesting, very interesting question. That is what I went back to look at. How did this happen? These endocrinologists are very smart people. There are two things that happen. One is they knew by giving insulin, you can bring the blood sugar down. So before they found out there is enough insulin, they started manufacturing insulin already. Then the gadget manufacturers got in. They have, from glucose strips to gadgets to measure the amount of blood sugar in your body very easily. So in type 1 diabetes, they knew if we can keep the blood sugar normal,
right,
but with insulin, their lifespan is good. So they believed what's called a confirmation bias. They believed this is the same thing. We will find a reason. They didn't want to wait for the mechanism or the validation. Now, around 1921 or 1930s, there was first reports of penicillin-resistant bacteria. So Dr. William Falta in Vienna hypothesized perhaps this is what is happening in adults with type 2 diabetes. Their body cells are not responding or resisting insulin. It was just a hypothesis he said we need to test out.
Yeah.
But endocrinologists couldn't wait to validate the hypothesis. All they wanted was a hypothesis to justify giving these people insulin, and the insulin companies and the gadget manufacturers were willingly supportive of that idea.
Wow, that's such a cover up, but it happens. It seems almost natural that it could happen.
Yeah.
In a sense that you you want to help, so you go ahead and this works.
Right.
And now you got a theory, okay, it can be looked at later. And then here's a whole thing completely missed, a complete misinformation, right? Like, yeah, incredible.
Exactly.
Wow.
So the question is, for the last 20 years, I've been trying to spread this message. The only way it can change is if we empower the patient, educate the patient. Just that is where you come in. That is why I'm so happy to be with you. Every type 2 diabetic patient should ask the doctor, hey, if I am resistant to insulin, why are you giving me insulin? If your body is resisting penicillin, the doctor won't give you that.
No, exactly. Yeah.
Okay. Secondly, even if I keep A1C below 7, 50%, I have 50% chance of getting my kidney damaged and going on to dialysis.
Right.
25% chance of having my vision gone. Higher probability of having heart attacks, strokes, Alzheimer's, amputations. So if insulin is the solution, why am I having all these problems? If the patients or the relatives can start asking these questions, then the endocrinologist will have to justify that's where it should start.
Well, that's often when they come see naturopaths, you know,
Yes,
and then we start with, okay, well, what are you eating? What produces, you know, so what are your carbohydrate levels and what, you know, so we're looking at more, you know, the holistic picture, their stress levels, everything else that.
exactly.
Yeah.
Now, the next question you can ask me is, if that is the case, how do you explain the increase in the incidence of type 2 diabetes that is happening for the last 30, 40 years?
Yes, let's go there.
Okay.
Perfect question.
What if you take the amount of food energy coming from complex carbohydrates about 100 years ago? It was 30 to 35% of daily average food energy intake. Now, in developed countries, it is 50%. In developing countries, it is 70% from complex carbohydrate. That is grains such as wheat, corn, rice, primarily. How did this happen? It happened because of two things. One, the agricultural revolution that made seeds more resistant and more productive. Second, the industrial revolution that made milling and refining possible.
Right.
In my view, grains were never intended for humans. Otherwise, we would have had beaks to pick them up and the ability to digest the chaff. We don't. But these two revolutions made it possible, and almost every government around the world subsidized grain farming. So now, when is the last time anybody had a meal or a snack without a grain or grain flour product?
Well, in my universe, often. But
right. This is why the incidence of obesity and type 2 diabetes is increasing all around the world. So think about this. If you don't put a carbohydrate containing food in your mouth, how can the blood sugar go up? So there's a natural remedy how to prevent it. So that is what.
And do you find in your experience that it's mostly grains and refined grains more than, let's say, carbohydrates can be from potato, from yams, from, you know, turnips? I mean, the root vegetables have some, not the same level, you know, but bananas, you know, as far as a fruit, papaya, you know, they also are quite high glycemic index foods. But do you find that it's grains and maybe it's the, you know, the way they're produced or the Monsanto version of them or whatever, the toxicity of it, the phosphoglycates. I don't know what have you seen that causes it to be?
Again, that is a common question I'm asked each time I give a talk.
Yeah.
If you take 100 grams of whole wheat, it is 77 grams of pure glucose. Okay, the complex carbohydrate in a grain is up to 2, each molecule of complex carbohydrate can have up to 200,000 molecules of glucose. They're just strung together. It's a long chain of glucose. If you refine that, the refined rice will have, in 100 grams of refined rice, it will have 80 grams of glucose. So whether it is refined or whole does not make any practical difference.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
What makes the difference is the quantity, how much you eat. And whether that carbohydrate comes from yam or potato or sweet potato or grains, it makes no difference except the quantity. Now, related to the quantity, there are two things. One is, can you think in nature of any food that an adult human being can get nutrients from without chewing?
No, I mean, except for the generation of people who are smoothie believers, which are, to me, doesn't make any sense because you're eating way too much, right? But no, everything else you have to take time, bite, digest,
Sure. This is why in the title of my first book is Eat, Chew, Live.
Yeah.
So how much can you chew boiled rice? How much can you chew soft bread, noodles, pasta? When you stop chewing, you swallow.
Yep.
So the way we eat, combined with the foods that made from grains and grain flour, cakes, cupcakes, you don't chew. There is nothing to chew.
Yeah. Yeah.
So you are not only not enjoying it, you're paying the price for it when they are absorbed. That is why I come to the grains, because most of the grain-based foods require very little chewing. You tend to eat more. So if you cut that down, you have better control.
Yeah. 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 So is there, is it, like, because normally we can feel satiated, right? We feel like we've enough, right?
Right.
But if you go to an Italian restaurant, or you have a big biryani, it doesn't matter which one, with vegetables and everything else.
Right.
I guess you have to eat quite a lot before you feel you're satiated, unless there's a lot of fat in the meal, right? Like sometimes, when you have enough fat in the meal, you get the signal that you're full without having to have as much of the carbohydrates. Is that something you espouse to? Is that
but again, that is a very very good question. I can answer it in two different ways.
Okay.
One is, let us look at when you are thirsty.
Mhm.
First of all, you cannot predict when you are going to be thirsty, right? Can you tell me when you are going to feel thirsty next?
Not
cannot.
really, no. Hmm.
When you are thirsty, can you predetermine how much water will it take to quench your thirst? Can you predetermine?
No, I don't think
No.
so.
Sometimes it takes 2 ounces, sometimes 8, sometimes
Mhm.
12.
Mhm.
When you are drinking, how long does it take for you to drink that water?
Mhm.
Just a couple of minutes at the most, right?
Right. Mhm.
And you stop drinking when your thirst is quenched.
Yeah.
Did you drink enough to fill up your stomach?
No.
No, your capacity of the stomach is almost 1 liter.
Yeah.
And if you have container with 12 ounces, you don't always empty the container
Mhm.
of
Mhm.
water. You drink enough to satisfy your thirst, to quench your
Right.
thirst. How does the brain know? Because the water is still in your stomach. It has not been absorbed yet.
Mhm.
It took 2 minutes. So how does the brain know you had enough water for that incident?
Mhm. Mhm.
Right?
Yeah.
So let me give you can I go on?
Absolutely. Yeah.
Suppose I blindfold you and give you something to drink. How do you know whether it is water or wine or beer or coffee or tea?
The taste.
Taste buds. What I am proposing in this book is those taste buds are not only monitoring what is on the surface, what's in contact, but also metering how
Right.
much is going down.
Mhm.
The brain already knows what is the water deficit.
Mhm.
And when the intake matches the deficit, the brain says, okay, you had enough. Your thirst is quenched. You don't need anymore.
Mhm.
There's a similar mechanism for other nutrients also.
Mhm.
So when you chew the food, the nutrient release, the rate of release is such that all the sensors in the mouth and in the nasal cavity can detect it, report them to the center, and the center will create the satiation signal. The example is, if you're hungry, first of all, you have to eat when you're hungry.
Mhm.
That first bite tastes so good.
Mhm.
After a few minutes, the intensity of enjoyment has gone down.
Mhm.
Why? Because the brain rewarded you by
Right.
creating the sensation of enjoyment because you are putting into the body something the body needs.
Mhm. Mhm.
If you eat a straw, anything that without any nutritional value, you won't get that enjoyment.
No. Mhm.
So the brain has to identify this is valuable, this is needed. But then the quantity control is already automatically built in.
Right. Mhm.
In order for that to happen, you have to chew the food, enjoy the food. Eating is your private enjoyment that you can have 3, 4, 5 times a day. There's no other enjoyment that you can do as many times a day and still have full enjoyment. Nothing.
Mhm.
So nature has given us the capability
Yeah.
to control our own intake and nutrient needs to live a healthy life.
Mhm.
Now, is there any example? Yes. All you have to do is look at toddlers between 2 and 6. If you look at how they eat, you will observe 3 things. One, they will eat only when they are hungry. Second, they will pick and choose. Grandmothers make 5 different dishes for the grandchild, and he will or she will come and say, I don't want that. I don't want that. I don't like it. But what they pick, they enjoy. Again, if you put a little, yesterday she enjoyed this, I'm going to put so much more today, she may not even touch it. And when she is done, She could care less what is left on the plate. She would rather go out and play.
Mm-hmm.
That's very different from an adult. If you are invited for a party, your first thing is how to please the host. The host made 10 different things. I have to taste all of them. Otherwise, the host may get offended. I'm going to go for all-you-can-eat buffet. I need to get my money's worth.
Mm-hmm.
And
Yeah.
the complex carbohydrate, they absorb water and
Right.
give you the feeling of fullness
Yeah.
as against satiation.
Yeah.
So over time, you have replaced the satiation with fullness.
That's a really good point, actually, because there is that, but it's different. You know, when you have something that is of real foods, you know, because if we're talking about real
Yes, yes,
to be
yes.
clear. But if you have, you know, even I'm going to go back to my Italian pasta, you know, that's a small portion of pasta, but you have, you know, the vegetables, or you have good olive oil.
Yeah.
You'll enjoy it,
Exactly.
and you'll feel satiated,
right,
without that feeling of, oh my God, I'm so full. You know,
exactly.
like, right. And I think that's that it, but I think that's one of the things too, you know, when you look at Mediterranean cultures, you look at well, even in India, if they use ghee, or do they use, you know, stuff that's not as good, you know, it makes a difference to your enjoyment.
Yeah. So that is what we need to focus on.
Yeah.
It is not how much you eat, it is how much you enjoy what you eat.
Mm-hmm. That seems so easy compared to it. It's not punitive. It's a lovely way of looking at food.
Yeah, yeah.
Yeah.
So that is all you have to do, is to enjoy what you eat. What you cannot enjoy, don't eat it.
Yeah.
Because then I ask people, if you take a bite of something, how much of that do you really enjoy?
Yeah.
Most people answer, oh, I enjoy all of it. I said, no, you cannot. If you put 10 potato chips in your mouth at a time, you enjoy only the one that comes in contact with the taste buds.
Right.
But you still swallow all of them.
Yeah.
So why swallow the 9 if only one can be enjoyed? It is that 9 that causes the problem, not the one that you enjoy.
Yes. Yeah. No, very good. Very interesting and doable ideas, you know, for
Thank you.
people. It's very enjoyable to hear this. Plus, I love food, so I love the idea of, you know, it's not a deprivation, it's more a consciousness
Exactly.
of the pleasure of what we have in front of us, you know, as long as it's pleasurable. I mean, how hard is that?
Yeah. It is more mindful eating.
Exactly. So which is also what chewing is, right? It takes time to so do you have a rule or a thought or a belief about how many, you know, like I know when I was young, I forget what my mom said, but you know, she said, oh, you have to bite it X number of times, you know. Of course, it depends on the food, and you know, so it's a hard one. But do you have any guidelines?
My first comment is, they were more observant, more sensitive. Their what was that they were trying to teach us was right.
Yes.
The number is immaterial. It is how much are you enjoying of that food. That is what they wanted to. If you tell them to eat, you know, chew, they don't know. So they put a number for convenience.
Right.
So that is not, to me, that's not important. But are you enjoying? If you are eating while watching TV,
you're not focused.
you're not focused. Half the food is gone before you know, oh, what am I eating? So when you have signals coming from the mouth and the eyes, human brain can concentrate only on one signal at a time.
Exactly. Yeah.
You can do multitasking, but you cannot concentrate. So if you're concentrating on your visual signals, which take precedence over taste signals,
Yeah.
then the eating becomes automatic.
Yeah. Yeah. Well, it's funny. I read a book. I forget, something like The Skinny Parisian Woman, right? It's something like this. And it was an interesting book. I read it maybe 20 years ago or so. And she was explaining how, you have your plate, the beautiful way that it's laid out, the sauces, your glass of wine or champagne, but everything, you start the enjoyment by the visual appearance, then you take your time to savor every taste, and so this woman was eating, all kinds of what our world often believes are not good. Oh, fatty foods and this and that. And she was eating whatever she wanted, but up until there was no further enjoyment,
Right.
And it
Exactly.
was like, you remind me of her.
That's exactly
Yeah. Yeah.
nature. And God gave us the capability
Yeah.
to enjoy.
Mhm.
And we are sidetracking that
Right. Yeah. Unnecessarily.
unnecessarily.
Yeah.
And we're paying the price for it.
Yes. Yeah. And then we have misconceptions and we get dogmatic interviews, and that's it. Anyway, our time is up, but I've really enjoyed this conversation. And
Thank you.
so where can people get your books and find out more about
Dr. John on Health or drjohnondiabetes.com? That's my website. And all my books are available on Amazon. And so I have written 6 books.
Mhm.
First 2 are on preventing body weight and diabetes. The second one is on reversing type 2 diabetes. Then around that time, I was diagnosed with cancer. So I was curious about what cancer is.
Yes.
And I wrote the book, Surviving Cancer, how to help my doctor reduce the medication.
Yeah. Yeah.
Even when they say, okay, you are a cancer survivor, what does that mean? That means with the available tests, they cannot detect cancer cells. That doesn't mean they are not hiding there. They are hiding. You cannot remove every little cancer cell from the body,
Mhm.
and they can come back unless you get your
You-
immune system strong.
Yeah.
And how to do that? Through diet.
Mhm. Mm.
Then I was giving a talk in a hospital, cancer hospital of all places. And one cancer doctor stood up and asked me, Dr. John, the average age of an adult with cancer is 60 because it takes 6 decades of accumulation of mutations for cancer to develop. Whereas the average age of a child with cancer is 6. How can the child have cancer? That made me start thinking. And a couple of years later, I came up with the answer: when your child has cancer. Because the simplest thing is, cancer is uncontrolled multiplication of a cell. So my first thinking was, how did the cell learn to divide?
Yeah. Yeah.
And what is the best evidence of controlled multiplication?
We should do another interview. I think we need to do another interview if you're up for it. I would love to do that on the cancer and children. So
yeah,
why don't we do that part 2 coming soon?
Yes.
And I'll be in touch with you.
Then I found out there are a lot of misinformation, disinformation, missing information. So how to navigate the information chaos?
Yeah.
That is one. Then if you have a minute, my other book is not here. If I can go up to there, can you give me 1 minute?
Sure, absolutely.
this is the book we are just releasing this month. Because each time I give a talk about diabetes, people will ask, what can we eat?
Right. Yeah.
I tell them severely cut down on the grains and grain flour products. So
Yeah.
I heard it so many times. I teamed up with Colleen Kakowski, who is a chef, and we are just releasing it this month.
Oh, great. Okay. Well, I'll put a link for that. And then I just want to thank you for your time, and let's do part 2. I'll be in touch.
Anytime, Dr. Manon, and I thank you for having me, and I thank our listeners and viewers.
Thank you for all that wealth of information.
Thank you.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.